Good afternoon, everyone, and welcome to Woonsocket. I want to thank the governor and his entire team for being here today at this important press conference to share some updated information regarding COVID-19 and the direction that the state is going in and the city of Woonsocket. I'm pleased to be able to continue working alongside the governor in this very important task of bringing health back to our state, back to our residents. As everyone knows, Woonsocket has been a bit challenged with getting our percentage rate to a point that we're comfortable with, and we are going to continue working to achieve better numbers. I would like to also take a moment to thank our fire chief, Chief Paul Chatraw, and our entire team of public safety officials who have been working probably the best clinics in the state of Rhode Island. I know I'm a little biased, but this particular location has been running like a very well-oiled machine, and we have received nothing but compliments. What we are going to work to do is to get more folks through the door and vaccinated in order to keep people healthy and hopefully have a better 2022 than we did in our 2020 and 2021. But I can't praise the governor and his team enough for everything that they've done to assist us and the other 38 communities within Rhode Island. I also want to thank the town of North Smithfield, the town administrator, Paul Zwolensky, who you'll hear from next, who's had his team of public safety officials working alongside ours to accomplish what we've accomplished here at Monsignor Gattery. So again, thank you for being here at this very important conference. And I'd like to now introduce Paul Zwolensky, the town administrator from North Smithfield.
Good afternoon, everyone. I'd like to echo the mayor's comments about teamwork. I'd like to thank the city of Woonsocket, the fire department, their police department, the public works, EMA, the same for the town of North Smithfield. It was nice to see this collegial atmosphere develop, and it's still going strong. I'm also very happy to say that the residents 65 years of age and older in North Smithfield, 100% of them have received both vaccines. But we have miles and miles to go. If they choose to get a booster shot, it's available for them at this location. It's a great place, as the mayor was saying. I wouldn't call it a happy place, but you can see the look on the folks that come here. They're very relieved to get these vaccines. So please, residents of North Smithfield, Woonsocket, please avail yourself to the boosters if you so wish. I'd also like to thank the governor. There was a time when the state was floundering. The governor came aboard and he asked the communities to help out, and communities did. So we're vaccinating people, we're keeping them healthy. I think spring is very promising. We should be past this crunch. It's going to be a little bit challenging for the next week or two, but I think we can get it under control. With that, I have the honor of introducing to you the Governor, McKee.
Well, thank you, Mayor and Paul, for your leadership, and being here today is not a it's certainly reinforcing the fact that we have an all-in strategy here in the state, and it includes our municipal leaders along with our state government. So I know that beginning on January 5th, right here, you'll start running every Wednesday night at the Monsignor Gattery School with a vaccination clinic for help the people in Woonsocket, North Smithfield, and nearby communities. So very important for us, and I want to thank the fire department, both in Woonsocket and North Smithfield, who will be stepping up to reactivate the clinic, get the shots in the arms, make it as convenient as possible, and that's our goal, is to create convenience. And we know that on a local level, I think that both the mayor and town administrator would both agree that their residents in that community will respond to a local opportunity in terms of both vaccination and testing in a way that will resonate around the state of Rhode Island if we're able to duplicate that in all 39 cities and towns. So we know that North Smithfield and Woonsocket are just 2 of the 20 communities so far that are now, after we met with them last week, the municipal leaders that are going to step up, not only on clinics for vaccination, but also many of those have also indicated that they want to participate in the effort on the testing issues, which are challenging for us for many reasons. But I would just say that local government is really a key factor in our efforts in terms of addressing the current surge that we're having in terms of infection rates. And we want to make sure that we contain the issues relative to our hospitalization rates. And I believe that we're on the path to do just that with everybody getting on board with the effort. So we know that, as the town administrator said, that we've come a long way since the time I became governor, sworn in as governor, in terms of our vaccination rates. And it has a lot to do with everyone, whether it's DOH, FEMA, our National Guard, and along with our municipal leaders and all the pharmacies, the CVSs, the Walgreens. They've had a great deal to do with it. As I mentioned a few weeks back, we were actually kind of like ramping down this issue with the COVID prior to Thanksgiving, and now we're ramping it back up. When I became governor, Rhode Island had the best testing in the country. And it continues to have the best testing in the country. But when you start talking about the amount of testing that's going on, over 20,000 tests in a day, we're in the process now of being able to absorb that in a way that not only will we get the results back in a more timely fashion, but also we're going to gear up in every community in the state to make sure that that we have the capacity and we can cut down some of the waiting lines that we know are there. So I would just say that this morning, we had another meeting with the municipal leaders and directed that. Yesterday, I was in Central Falls with Mayor Rivera. What I saw there was that we needed to do a great deal better in terms of the customer service, the way that it was structured. I think that we're getting that done today. I think that in a way that is going to really important and it's going to resonate as we continue to touch base with all our municipal leaders in the state of Rhode Island. And I want to thank our municipal leaders for stepping up. Their partnership has and will continue to be crucial for our COVID-19 response. While we're on the topic of the municipalities, as I just shared, what I saw in Central Falls was that we can do a lot better yesterday. You know, long waiting lines, not differentiating between people who had appointments and not having appointments, and an indoor strategy that is actually going to make it more convenient, not only for the people in Central Falls, but also it's a good lesson for us to respond to around the state. So I thank Mayor Rivera for her leadership and her vocal advocacy for Central Falls. And I expect the same thing from Mayor Baldelli Hunt, as well as our town administrator, as well from Paul as well. So we've heard from several communities that in addition to doing vaccinations, they have the capacity to do more testing, and that's one of the messages that we're delivering here today. And we'll be working with them, to make sure that that happens in a way that's convenient and it works well for the people who live in the different communities. I can't stress this enough. While we're testing more people daily than at any point during this pandemic, our municipal leaders need to be part of the process to help the capacity issues. They have ideas, and we need to listen to them. And that's why I'm committed to making sure that each and every community is part of this effort, of this all-in government effort, whole government effort, which includes our municipal leaders. Today, I also wanted to help ensure that this happens. I'm announcing that Rhode Island Emergency Management Agency Director Mark Pappas will begin a temporary assignment as a senior advisor and chief COVID administrator in my office. This is something that Dr. Alexander Scott and I talked about last week. We have agreed that a more all-hands-on-deck effort is going to be important, and we're reverting back to during that April, May, June time frame of 2020 to make sure that we're leading and coordinating the whole government COVID response team, working closely with the Department of Health and RIDE and Commerce and DBR and all the municipal leaders and our National Guard, and making it an all-in effort. So Director Pappas will be the dedicated person on our team who is focused entirely on the COVID operations on a temporary special assignment. So I thank Mark for stepping up and adding to our team effort here. And I know Mark, I let Mark know yesterday that one of his first jobs was actually to address the Central Falls testing sites. He and his team and Department of Health, I headed out there again today to work on a solution, and after that, I know next on the list I'll be working with Mayor Lawzer to get more testing capacity in the key neighborhoods in Providence and beyond in all communities. And we made the offer today that all municipal leaders could certainly call on me and our office to make sure that coordination happens as we enter into a time frame that we are going to be challenged. The last thing I'll say about a municipal leader call, I let the mayor, town administrators, managers know that if the Senate does not act on a vote on the Open Meetings Act legislation as they come back into session, that our administration will on the legislation that our administration submitted to the General Assembly last year, that I will act and through executive order to put in place temporarily an open meetings remedy to some of the issues that the municipalities are calling for. So the best outcome would be a more long-term solution done legislatively, as I've said, but we will work to ensure we're responsive if that doesn't happen right away. Last week we said that two of our top priorities were increasing our vaccination capacity and increasing our testing capacity. Today we want to update Rhode Islanders on the progress that has been made, that we've made, and our goals for the next few weeks. I want to start with testing. This week we brought on a new lab which will help improve the PCR test results turnaround times. The lab began processing samples this week, increasing our capacity, and over the next couple weeks we will be adding a third lab to expand the capacity even further. Our goal is to get back to a 48-hour turnaround time on the PCR test. We will continue to open additional sites over the next couple weeks, and I've let our team and at the Department of Health know that we're working together to get this right, and it's crucial that we get the testing right at this point in time. I also want to announce that I've directed our team to get state testing sites open on New Year's Day. There's no reason these sites should be closed during the holidays, especially at this point in time when we're creating a great deal of urgency in terms of responding to the pandemic and the place it's at right now. We anticipate having several thousand appointments come online later this week to help increase the access after the New Year's Eve. On vaccinations, in addition to testing, we're also making progress on expanding our capacity to get shots in the arms, especially booster shots. I've already mentioned the 20 cities and towns that will be reactivating local vaccination clinics to help expand our capacity and making getting a booster much more convenient. Our team is continuing to work closely with cities and towns to provide more vaccination and testing opportunities in all 39 cities and towns. On top of that, I am announcing that we will be reopening a mass vaccination site at the Rhode Island Convention Center as soon as the week of January 10th. Both testing and vaccination will be available at this site. And I want to thank our team at the Rhode Island National Guard, who we've relied on so much over the last 2 years. And we're back knocking on their door asking for help, and they're mobilizing as we speak to help stand up and operate these vaccination sites. Hospital staffing. We are continuing to work closely with our local hospital leadership on strategies to address their long-standing staffing issues, which have been amplified by the COVID-19. We're working to respond to requests that the hospital put in front of us. That's exactly why I put in place mitigation measures like masking and proofs of vaccination a few weeks ago. Last week, at the hospital's request, I issued an executive order that would provide liability protection. We did this because hospitals communicated that the threat of lawsuits is contributing to the staffing crisis and can hinder recruitment and constrain medical professional judgment and limit hospitals' flexibility to adjust medical staff to patient ratios. And we changed our policy to ensure that if someone has a valid license in another state and wants to come and work in a hospital in Rhode Island, we will grant the temporary license right away. As recently as yesterday afternoon, I had a meeting with hospital leadership, representatives from the federal delegation, and our whole government response team to discuss staffing. The National Guard was part of that call yesterday, and I spoke with General Callahan this morning, and his team is having a follow-up discussions directly with the hospitals to get from them the specific job categories that they need to support with. And I want to thank again the Guard and General Callahan for their continuing efforts to explore how to make this work effectively for the hospitals and their needs. Just before coming today, I spoke with Labor Secretary Marty Walsh about another serious issue raised to us by the hospitals leadership when it comes to the extremely high cost being charged by companies who are sending traveling nurses to our state. On that call, Landmark was on there, and we talked about a specific example of how this is working against us. The very nature of the project was to help staff up hospitals, but what the reality is that it's costing an inordinate amount of dollars on the staffing. And what's happening is, for instance, we had a nurse in one of the hospitals sign off on their shift, and the next day they got a call from the traveling nurse management team, that they could supply a nurse to that very hospital the next day. It went from $45 an hour to $195 in one day. And when you multiply that over and over and over again, this is putting an exorbitant amount of pressure on the finances in the hospitals. So we've been working with the congressional delegation. I've had conversations. I expect to have another conversation with Secretary Walsh and the Health Secretary on this very issue. This is a national issue, and anybody who thinks that there's an easy solution to this challenge is not paying attention. But I believe that one of the solutions is that we wouldn't allow during an emergency or a crisis gouging on gasoline prices, gouging on milk prices. So why would we allow this gouging that's going on right now in terms of workers? CDC guidance preview back to school. Just a minute, I'm going to turn it over to Dr. Nicole Alexander-Scott to provide an update on new quarantine and isolation guidance from the CDC and what that means for Rhode Island. Right now, we know that back to school is a top of mind for many students, family, teachers, and school staff. Together with the Department of Education and Department of Health, we have come up with a way to safely bring our students back to school in person learning, just as we did at the start of the school year. Yesterday I had a comprehensive meeting with not only the RIDE, Department of Health, the superintendent representation, school committee representation, the AFT and the NEA, and our office to discuss this very issue about reopening our schools. From our experience and based on the data, we know that schools are one of the safest places for students to be. That's why we are confident in saying that schools are expected to return in-person learning after the break to limit further disruption in the learning process. The state has been working hard to expand access to vaccination and testing to keep students in class where they can benefit from the academic and social emotional supports of in-person learning. While there are no plans for the statewide distance learning, some districts may take a phased approach for their return to allow for testing, and I will go over that in a moment. Districts will determine what works best for them and should be communicating their plans with their families in preparation. Our layered mitigation approach, which consists of vaccinations, masking in schools, testing, distancing, and ventilation, has helped us ensure safety in our schools. And based on the recommendations of the CDC and the data we have, we are making some revisions to policies for schools to help keep students in class. RIDE will be communicating with the district leaders directly on these changes and sharing that info in a press release. And we'll speak to that today with Victor Capian will address some of these issues as well. To highlight some of the updates, these policies, students who test positive and show no symptoms or whose symptoms start to go away can now leave their house after 5 days. They may return to school on day 6 with no symptoms and follow mitigation strategies like masking and other precautions that we have set in our schools. This is a shorter isolation period, meaning students can return to school sooner. And we will continue with that approach and closely monitor the situation and adjust as needed. COVID has presented us with a wide-ranging challenges, and we've had to adapt, but the priority is keeping students in the classrooms where they can learn best. I want to thank our students, families, teachers, and support staff for their continued collaboration, along with those who met with me yesterday, as I just described, to address a common strategy that we can rally behind to make sure that our students are safely in the classroom, along with our teachers and staff. To address specifically Providence return to school plan, the districts weighed several factors. With safety in mind and out of an abundance of caution, the 21,000 students in the districts at Providence Public Schools district made the decision of having a staggered return to school for pre-K to grade 12 students beginning Monday, January 3rd, 2022. This phased-in approach will allow districts to conduct testing as students return to prevent potential exposures. Those who are not in person will be expected to participate in distance learning to minimize the disruption of the learning. The district has been preparing for this. Heading into the peak, Providence Public Schools had a series of community events where they vaccinated over 400 people, provided over 1,000 home tests, and distributed 50,000 meals. We recognize that testing is the key, so Providence Public School will be hosting COVID-19 testing clinics for the Providence School students and their families for this upcoming Sunday, January 2nd, 9 a.m. to 12 noon at the Providence Career Technical Academy located at 41 Fricker Street. I would just say to the other families in the state of Rhode Island, just check with your local districts. I know that they are planning on doing testing strategies leading up to the opening of school, and I would refer you to the local districts on that. All right, so we have Victor Capian, who will, from the Rhode Island Department of Education here today to answer any further questions about the return to school. I also want to take a moment, big shout out for the Dunk last night. They had a big game last night. I was watching some of that on TV, and the mask wearing looked very good, and that was a big effort for demonstrate the need and the cooperation from the people in the state of Rhode Island. Our team connected with the Dunk today and heard feedback that overall things went very smoothly, and I want to thank the staff at the Dunk, all the players, spectators for stepping up and doing the right thing, and also way to go PC on a big win. I don't know if you followed last night, but PC is 21st ranked in the country, and they defeated the 15th ranked team in the country, Seton Hall, last night. So that was really good, and then we were able to have people there to cheer them on. So I thank the people that were there wearing the masks, where other states and other professional teams are canceling events. If we do things right, we can keep those events going, and that's not only important to our universities, but our economy as well. So thank you for showing up and wearing a mask and cheering on the Friars. I certainly plan to do that before the season's end, both at the Ryan Center and at the Dunk, cheering on our home state teams, and I've got an invitation to go to the other universities too, and I'm going to try to make that happen. So that was a lot of information. And there's a lot of work going on, and I want to thank you for those who are listening to sticking along with all that information, important information. I'm going to hand it over to Dr. Alexander Scott, and then we'll have Victor say a few words, and then we'll be open to questions. Doctor?
Good afternoon. Thank you for those updates, Governor. And thank you to the teams in North Smithfield and Woonsocket for hosting us today, including Town Administrator Zelensky and Mayor Baldelli Hunt. These press conferences have been an important part of our COVID-19 response. While we post data 5 days a week online, these press conferences give us an opportunity to put a little more context around those numbers and to welcome you as ambassadors in spreading the news and the important information that we're sharing. In going through our data and in adding context to what we're seeing with our data, we have always pledged to communicate with you directly and transparently, so that this is the place where you can come to get the information, know that the data is going to be accurate and is going to equip you and your loved ones with what's needed to do best, calmly and confidently. In continuing that spirit of directness and transparency, I want to share what we are expecting January to look like. It indeed is going to be a difficult month from a COVID standpoint. It's not only here in Rhode Island, it's regionally, and it's nationally. We're in an unprecedented moment within an unprecedented 2 years plus period of time. The shift indoors with the colder weather, the heightened transmissibility of the Omicron variant, that's double what we were already saying is occurring with the Delta variant, the holiday gatherings, and the general increased levels of social interaction all mean that we could sustain case numbers through the middle or end of January that will well exceed the peak we have ever experienced throughout this entire pandemic. That's why it is so critical, and it's great to have a reestablishment of that whole of government team. So we're glad that Director Pappas is here and helping to provide that structure with our other state agencies, joining in with the engagement with General Callahan and the amazing Rhode Island National Guard, and what we've been doing at the Rhode Island Department of Health and across all of the agencies. Really having that unified effort together is going to be critical, getting us through the rest of the next several weeks. This week, we have already had 3 days with more than 3,000 cases each day. And we believe that what we're seeing now is still predominantly Delta variants of COVID. Our rough estimate is that only approximately 10% or so of infections in Rhode Island right now are Omicron variant cases. What I said when I was with you last still holds true. If you're going to do just 2 things to keep yourself and your family and loved ones safe, they should be these 2 things. Wear your mask and get vaccinated, particularly get boosted. That's going to give you the full protection that you need, particularly as we prepare for the Omicron variant becoming predominant. Number 1, masks work. We know that. Anytime you leave your home, bring your mask and put it on when you are around other people. Number 2, the COVID-19 vaccines we have are very effective at preventing serious illness and hospitalization. Those are the key things that we have been saying since day one pertaining our vaccines. They are excellent for keeping you out of the hospital and for keeping you alive. Analysis after analysis of our own Rhode Island data is showing that you are much less likely to get hospitalized if you have been vaccinated. And you enhance that protection even more once you get a booster dose. So I really want to re-emphasize, we have this window of time before Omicron becomes predominant. Go today and get boosted. Fortunately, the data nationally are confirming what we had originally believed. While more transmissible, the Omicron variant seems to be causing less severe illness, hopefully. This could mean fewer hospitalizations than you would otherwise expect. However, given the case rates that we are seeing now, as high as they are, and the case rates that we anticipate continuing to increase, we will naturally expect hospitalizations to increase as well, just based on the numbers alone. That's why it's all the more critical to follow those 2 points. They must be layered together to have the greatest effect. On top of wearing a mask and getting boosted so that you're vaccinated with the utmost protection, also think about limiting your exposure overall. Delta variant is contagious. Omicron variant is even more contagious. So, for example, tomorrow is New Year's Eve. If you are in a setting with a lot of people you do not live with, you're just automatically in a higher risk situation. That situation becomes much higher risk if you're not wearing a mask and you're not vaccinated or boosted and you cannot physically distance. You can look either way and already see examples of positive cases that have occurred thus far through the holidays at alarming numbers, friends, family members, neighbors. Take that information, take the tools that we're equipping you with to choose how to behave differently going forward. It's just critical to know that we cannot treat this holiday, New Year's Eve, the way we treated it prior to the pandemic. It's different, but we have the tools we have that can help make it so that we can go forward safely. Wear your mask, get boosted, and limit your exposures. Shifting gears, I want to provide a little more detail on the change to our quarantine and isolation guidance, which the governor referenced. Aligning with the Centers for Disease Control and Prevention, we have shortened the isolation period for someone who was COVID positive from 10 days to 5 days, provided that that person has no symptoms, is asymptomatic, and will wear a mask for 5 additional days. Another change is that if you are a close contact, you do not need to quarantine if you are asymptomatic, you don't have any symptoms, and if you received a booster dose or you completed a Pfizer or Moderna series within the last 6 months, or a Johnson & Johnson shot within the last 2 months. People in this situation should wear a mask around other people for the full 10 days and get tested on day 5 if possible, which is why we're doing everything we can to continue to ensure that the testing capacity that was already top of the line nationwide is going to expand even further. Data consistently show that people who are boosted or who recently got their primary series have the highest level of protection. For that reason, there are certain people who will still need to quarantine when they are close contacts, including people who are not vaccinated and including people who were vaccinated a long time ago and haven't yet gotten their booster dose. We know that this is a lot of information. It's easier to see this guidance and read it so that you can process it even more so than just hearing it. So we have these updates posted for you online on covid.ri.gov, along with a frequently asked questions document that's available. One thing I want to make clear is that updated guidance specific to schools is forthcoming. That guidance will have a broad array of mitigation strategies that we know are critical to layer in place to eliminate unnecessary quarantines and to reduce the workload on school staff while keeping students in person and keeping them and their staff safe. So the quarantine approach for students will be a little different, and we'll be sharing those updates with school leadership soon. The last topic I want to turn to is testing. Right now, the demand for testing is outpacing supply in almost every state in the country. They're seeing it in Massachusetts, in New York, down south, out west, everywhere. The reality is, we're doing a little better than most places in the country. That's what happens when we're leading the nation in testing up until this point, as we will continue to do. Even with the enormous demand we're seeing, more Rhode Islanders are getting tested every day per capita as compared to the residents in almost every other state in the US. So that leading role is going to continue with going forward. We know waits for tests and turnaround times are not where people want them to be right now. You have benefited significantly from a tremendous program that has made it so that those are not norms, and we are not expecting that to become a norm. We are doing everything we can to continue to expand the capacity far beyond we've ever needed in the past, but to continue to deliver the type of services that we have provided to Rhode Islanders month after month after month. We know we will get better. We've been here before. We've done it appropriately. Last year, the turnaround times were well over a week, and we talked about being able to get that down and have consistently since that time had it less than the 48 hours. So with unprecedented numbers, we are confident that we'll get to that place that everyone is comfortable with and familiar with, and we want to charge everyone, particularly those who have symptoms and who need it, to access the testing program that's available. We've started to take steps in the directions needed to expand testing as creatively and innovatively and effectively as we can, the way we always approach all of the changes that we are responding to. We've opened 3 new rapid test sites in Bristol, Providence, and Newport, and we've onboarded another lab to improve our PCR test result turnaround times. In response to the demand we're seeing, as the governor shared, we'll also have many sites open on New Year's Day. Between these changes and the significant influx of at-home tests that we're intending to push out throughout the state, really focusing in on those communities hardest hit, we intend to relieve some of the pressure at our state sites, and our PCR turnaround times will indeed be closer to the 2-day mark that everyone is familiar with shortly. Our last thing that I want to add is that the fastest way to schedule a test at a state-run site continues to be self-scheduling at portal.ri.gov. RIDO's call center agents do not have access to any additional appointments beyond what you can see on portal.ri.gov. As we continue to see elevated case rates, we know that people want to get tested. You've heeded our messages over the months. So we're going to continue to work to get more people tested, and we'll continue to work even with that significant increase far beyond what we've ever seen in terms of capacity. We're going to still work to get you those results even faster. As you know, we always give it our all, and we'll always make sure where there's room for improvement, that that's what we focus on doing. The reminder for you is knowing that testing is one component of everything you can do to limit your risk. Wear your mask, get vaccinated and get boosted, keep your groups small, limit your exposure. If you're feeling symptoms, stay home and try to get a test And if you're unable to get a test early on, just assume that you're COVID positive and change your behaviors accordingly. As I said earlier, we know the next several weeks are going to be difficult, but we've been here before. Rhode Islanders can have the utmost confidence in our ability to respond to this. Although our systems are stretched and taxed, we've been adapting, and we've been creative, we've been committed throughout this response, and we'll continue to do that now and going forward, also welcoming the whole of government response to join with us. So now is the time. Folks have often said, you've brought a calm to what's going on, you've created some clarity. Let's grab onto that. Let's take that calm, let's take that confidence of knowing what we in Rhode Island, in Rhode Island have available to us, and hold on as we go forward through this time together. Make the good choices, wear your mask, get everyone you love vaccinated and boosted, and limit your exposures, and we will get through this strong as we have done. Thank you. With that, we will open it up for questions.
Governor. Start over here with Steve. I know we have a lot of people, a lot of questions, so just keep it to one each. We'll get to as many people as possible.
Governor, good afternoon. Massachusetts this week is forgive me, I can't get rid of this mask.
Yeah.
Massachusetts this week is distributing something on the order of 200,000 at-home test kits to school children across the state. Do you not have a number of test kits, at-home test kits to distribute? I mean, can you replicate something like that? And to test this weekend, they're going to hand them out in Massachusetts before they go back to school on Monday.
Yeah, so I think I probably have to go to Tom or to Mark on that one in terms of the availability of our, rapid testing and the test kits, certainly in the plan. I don't know whether we have any currently that are being distributed or not. Tom, what do you got?
Yeah, thanks, Governor. So as we shared last week, we're going to be looking to push about 1 million at-home test kits out each month to Rhode Islanders for the next several months. We have already pushed every at-home test kit that we have on a shelf here in Rhode Island out. So we're competing, nationally to bring some additional ones in. But I think what's important too is, especially when we have limited resources, there's a number of different ways that we can ensure that we're safe. So as the governor shared, and as Victor I think can share some more detail on, we've had a robust testing program in our school, in our LEAs for well over a year. So many of them have a plan in place to test students appropriately before they return. We also have always prioritized our pre-kindergarten through 12 testing lines. So at our state sites, even though the availability is limited, those appointments are set aside, and we still have some appointments that are available. What's important though is using the testing appropriately. If you find yourself in a high-risk setting, if you have symptoms, those are the folks that we want to get tested. We no longer have that luxury now to use that as just a quick check to make sure if you're asymptomatic. We want to continue to expand so that we can get back to that, because a key part of this is enabling that we continue to do the things that we love safely. But with regards to schools, we just have a bit of a different approach here in Rhode Island.
Ryan?
Governor, we've heard from some doctors who are frustrated by the pace and urgency of your administration's response to what they consider the collapse of the state's healthcare system, both related to COVID and the staffing shortages. What's your response to that criticism, and do you agree that the system is collapsing?
So I certainly disagree with individuals who think that somehow that there's an easy answer to this and that there's an easy response to that. Like I said before in my comments, I don't think they're really paying attention to the work that we're doing. So yesterday alone, we had, again, I'll describe, we had leaders from all the hospitals in the state of Rhode Island. We had our congressional officers on the call. We had Department of Health. We had, our office as well as. So we're pursuing the options that can make sense. And we're going to continue to do that in a way that, and we're going to directly work with, and we have actually had the Physicians Association represented on that call as well. I'll go back to what I said in terms of some of the staffing issues. it was described that about 1/3 of the financial issues that they're having is because of the traveling nurse structure in terms of the pay. Just before we came here, one of the people who were on the call who were representing doctors was offered a $50,000 bonus to move out of state. So this is a federal issue that we need to address. So anybody who, I'm going right to the White House. We did a letter today to the White House, and we talked to the White House yesterday, and like I said earlier, we talked to Secretary Marty Waltz. We're going to be on with another secretary nationally. So, yes, the individuals, I get their frustration, I get their concern. We're hearing that there's a great deal of stress at Rhode Island Hospital because of the structure of that hospital and the procedures that they provide. But right now, it's not easy, and it's a challenge. But the word that we're getting is that they are definitely meeting that challenge up to this point, and we're going to continue to talk to them in ways that we can help and assist them.
Governor, are there any plans to reopen the drive-through testing sites? We've been seeing lines around blocks, people waiting in the rain and the cold, considering.
Yeah, I'll let Mark handle that one. I think there is a drive-in that's setting up, right, Mark? Or Tom?
Yes.
Yeah. Yeah.
The answer, yes. So we're going to expand, as the governor said, all testing sites all throughout the state. As Dr. Nicole Alexander Scott articulated, vaccine throughout the state if we can at those sites. So yes, there's an initiative in play to expand those sites.
Respectfully,
I'm sorry, I skipped you. Go ahead, please.
Governor, how quickly are you able to ramp up? You're saying Dunkin' Donuts Center January 10th or 11th? That's 10 days in the future. What is happening right now today for folks who are trying to get tested or who are ill?
Yeah, so I think that again, we're doing well over 20,000 tests a day. I think that we need to make sure that build the expectation of, coming from about 10,000 a day to 20,000 a day. We expect that progress is going to be made each and every single day. I think that the explanation at the convention center, the guard is being called back in, and they want to make sure that they've got it right so they can proceed properly. I think that you're going to see communities like East Providence that are already doing, vaccinations. Talking to the mayor there, they're going to be opening up testing sites as well, and we expect that that's going to resonate around the state of Rhode Island in a collective way. That's why we're here today, right? We're here today to recognize municipal leaders that are stepping up in a way that we need to make sure that happens. We're going to accelerate it based on the need, and I would expect that we're going to be making progress, immediate progress. But that's not to say that we haven't stubbed the toe here a little bit on the testing, right? That clearly has happened. We recognize that, and we're making the immediate adjustments that need to be made. And based on what I reinforce what Dr. Alexander Scott says, look, we've led the country in testing. We continue to do that right now, and we're going to work our way through this as quickly as we can.
Ramp up earlier December before folks got together for Christmas. Are the tests not available? Are the labs not available? Why not do it sooner?
Yeah, well, I think that we always can look in the rearview mirror on things, and perhaps if you had a crystal ball, you could have done that. But remember, we didn't until coming up to Thanksgiving. This issue was not on the table. Infection rates increased, on December 4th, and then did it again on December 11th weekend and on December 18th. And we've been working on this for a couple weeks. And again, we're doing, I think, what do we do? How many tests did we do yesterday? 20,000? 25,000 tests were done yesterday. So the work is being done, the testing is being done, and we need to get better at it. But the fact of the matter is that we still lead the country relative to testing. We're not going to lose that space, and we're going to do the work that we need to do. And again, I think that what I said before, that's why our EMA director, Director Pappas, I've reassigned him to special duty here, and he's going to be working right out of our office right in the State House.
Right.
Bringing Director Papa into your office because you don't have no confidence in Dr. Nicole Alexander. It's not a good relation. Because before with Gina Raimundo, it was a better communication. Now we ask questions and we had to wait a month for an answer. And then after that, you reply to that, let Vito Capellan speak to for the Providence School Department.
Yeah, we can do that, but I'll push back on that. The role that we have is different in all our respective positions. We're meant to share information in a way that makes sense, and our outcomes are we're still leading the country in testing right now and we're leading in vaccination. We are still holding our own in terms of infection rates in the country. We're still holding our own in terms of death rates. We want to be the best. So good is not good enough. All right, so we're going to keep on working on that. But I think I don't think that's an accurate depiction in terms of the outcomes that we're getting. We are working together. We're on calls every single day, and we're going to continue to do that. Victor, you want to come up and fill in a little bit on the education issues?
Yeah. Thank you, Governor. So we wanted to take an opportunity also to just say thank you to all of our school leaders and all of our school teachers and staff, to all of the families and students, certainly for the work that they've been doing together. We appreciate the work that we are doing in partnership with the Governor's Office and the Department of Health to make sure that our schools are ready to come back to school next week. We have been working hard, as you heard, to expand testing. We have a number of initiatives that we're working on. Later on today, we will be releasing additional guidance to our school districts, and we'll be working directly with our superintendents and school leaders to make sure that they have the supports that they need. We know that one of the places that is doing a staggered start is in Providence, and so Providence will be doing a different start. Each community is going to be adapting to their local context, and we're working with them individually to support each community to make sure that they are doing what they need in their communities. The one invitation that we do have specifically for Providence families, as the governor mentioned, we have a testing clinic for Providence students and their families this coming Sunday, January 2nd, from 9 to 12 at PCTA. And so we're really encouraging as many families to bring their students to be tested. And we have heard from parents across the state that they want their children in school. We're taking action. We think that these new guidance from the CDC and the work with the Department of Health will make life easier for our students, our families, and educators alike. And while we're protecting their health and safety, we're looking forward to working with our leaders to have our students in school. Thank you.
Yeah, hi. I'm just wondering if you can speak to when we can expect the response rate for tests to get back to that 48-hour window, because folks are waiting quite a long time right now.
Yeah, so with regards to the PCR turnaround time, so we onboarded a lab, they started receiving samples, and we had to go pretty far from Rhode Island inside the region to find one available, but we've doubled our lab capacity. So what that means is our PCR turnaround times are starting to come down this week, and we're confident that by next week, our PCR turnaround times will be back about the levels that Rhode Islanders are used to. Again, we prioritize them. We have 120 long-term care, congregate care facilities that are in that enhanced outbreak response protocol, and those are first in line, keeping people alive and keeping them out of the hospital. Those are staying between 1 and 2 days. Our schools are about 2 to 3 days, and our general population, general public is about 3 to 5, but those are coming down. But the goal is to get them all down below 2. With that, we need to continue to expand. It's already twice as big, our lab capacity, as it's ever been. We're expanding to additional labs, and we're purchasing through our partners here, are purchasing additional equipment to get that capacity back in state in Rhode Island.
We have time for 2 more questions. Pat?
Dr. Scott?
Where's the lab? New Jersey.
Dr. Scott? Question. Jackson Healthcare is a significant facility, healthcare system in the Miami, Florida area with roughly a capacity of about five of our largest hospitals combined. They took the provocative step of acknowledging that 57% of current COVID-19 hospitalizations, in fact, are incidental, where COVID is present but was not the precipitating factor in hospitalizations. Will organizations like Care New England, Miriam, Rhode Island Hospital be disclosing that type of information?
They will continue to relay the data that we are currently displaying in terms of hospitalizations overall. What we have up on our website now works well. We've done an analysis of the data and understand that, and are going to continue to relay it in a way that is helpful for Rhode Islanders. Right now, it's close to 90%, and so that's something that we'll continue to follow.
All right, last question, Michael. Pat, we just got to get to Michael. And that's the last question.
Thank you. Governor, I'm concerned that, you said that if we had a crystal ball, we could look back and make certain decisions and do things differently, but that we didn't see the increase in case rate until Thanksgiving. But I respectfully would not characterize the data that way. It looks to me that we've been seeing a significant increase just on the state's own data from 7-day caseload or 7-day interval caseload dating back to about the middle to the end of October. And I specifically remember asking that question at a press conference at around that point. And that's about the time when we started seeing caseloads effectively doubling in that 7-day window.
I don't think that's correct.
Well, I'm looking at the data in front of me.
Certainly followed that data. We were in a ramp down strategy because we were getting lower infection rates through the beginning of November. So look, you can look back if you want to look back. We're still in a spot where we feel comfortable that we're providing the health needs that we need, keeping the economy open, getting our kids in school in a way that is working on behalf of the people in the state of Rhode Island. So I'll look at those numbers again, out of respect to the question, but I don't believe that's accurate in terms of early October. Actually, we were reversing that trend, not increasing that trend. I'll look back and certainly clarify that, and when we get back together again, if I'm wrong, then I'll certainly admit that. But the data that I've been looking at, like I said, we were in a ramp down strategy the week before Thanksgiving. We were clearly in that. But we've responded to the issues that are directly in front of us, and we have increased the capacity of the testing significantly. The area that is challenging right now is getting the results of the test. So, and then we're addressing that as well. But we've grown, to 25,000 tests in a day yesterday. I mean, there's virtually no state, if there's any state in the country, that's doing that on a per capita basis.
That's certainly true, Governor. Rhode Island is 10 times better than some of the states on the lower end of testing. There's no question about that on a per capita basis. Rhode Island is the national leader. I guess what I'm really asking is, could we have possibly missed some early warning signs beginning in the middle of October?
I don't think they were there in the middle of October.
Okay.
Yeah. Yep, thank you.